thank you for asking the questions, because as you told that the incidence increase, actually increase or not we can tell. The diagnosis has increased because of the advent of ultrasonography. Previously, all the abnormal uterine bleeding that you know by Figo classification, we will take into an abnormal uterine bleeding. It may be menorrhagia, polymenorrhagia, HMG, abnormal uterine bleeding like that, or pain, anything. But nowadays, every and each case we do a scanning. So whether symptomatic or asymptomatic, we get so many fibroids. If you take rampantly ultrasound at age beyond 30 and between 40, definitely you will get more than 60% cases having fibroid. In case of, I could know this molecule fibronon, and it was my first molecule in the era of COVID. Because in the era of COVID, we could not do anything. Either you have to see the patient from a distance, or by WhatsApp, or by internet. And in that case, if they are bleeding also we have to manage, if they are non-bleeding also manage. That time I started, after your Satyajit Padi, they came and the team came and told me about this molecule. Then I started rampantly and I was benefited. Patients were benefited. So why you operate? And I am in such a position, and in my I am a person in a medical college with a 40 years experience. I always prefer non-surgical treatment of my patients. And here in our place, patients are not preferring surgical treatment. They fear even minor or major. So best option. And about your embolization, other things, tertiary, other things they cannot afford. It's not available here. Only hysterectomy you do, or you do myomectomy, or you that. So that time I could know the noble molecule that is fibronon and benefited. I was benefited, a patient was benefited. Because patient urgency is not there. It may be there's a question in MBBS and MD also. When do you want to operate the asymptomatic fibroid more than 14 weeks, rapidly growing fibroid, and broad ligament fibroid, and subserous fibroid, like that. So that has to be treated. Better to do a surgical. These are the cases. But when there is a symptom, according to symptom you treat. So symptom fibroid, those were supposedly unmarried patients. Just mom with a small fibroid, and this little bit when HMG is there. Why you will operate? You give medicine. After 3 months, the fibroid size decreases. The symptom also decreases. Very beneficial. So first type of patient, infertility. All infertility with the fibroid are not, myomectomy not indicated. You have to counsel the patient that this fibroid is not the cause of your not having a baby. And if you are having a baby also, it is not going to harm your body or the baby by presence of this small fibroid. So, but they want a treatment. So you give fibronon if they don't want pregnancy during that period. So that is the second indication. So then patient severely anemic, cannot get blood, cannot be operated. So I want to delay. They are not ready for surgery. I give fibronon. I have kept all data of my patient. Patient belongs to 16 to 52 years of age, and maximum between 30 to 40 years of age, maximum patients. And asymptomatic fibroid was 60%, symptomatic fibroid was for less 40%, and their first advantage, decrease in bleeding amount and decrease in the pressure symptom. Second. Third one is advantage is that decrease in size after 6 months to 4 months by ultrasonography follow-up. These are the 3 results I got. And few patients were resistance, maybe 5 to 10% resistant to get a surgical treatment afterwards. See, our uterus is nothing but the first motherland of anybody. What is your first motherland? It's the uterus. So for a small cause, why should you take out the epitome of womanhood, that the uterus? Why unnecessary myomectomy before 40 years or even 50 years? In Western countries, they don't remove for a small fibroid one uterus. There are so many options, and best option is this molecule. So unless very much required, don't go for a major surgery. I don't like that. Okay? Because I am senior, they follow my prescription, I don't know. But my student, my colleagues and everybody has been immensely benefited like me by prescribing this molecule, this non-hormonal molecule of fibronon to so many patients, and also they follow my prescription and they are benefited, patients are benefited. Thank you very much.